So at Reserve Health, every relationship with a prospective client begins as a conversation, understanding what their goals are, what their needs are. Sometimes it's us bringing our expertise to the table, and sometimes it's ensuring that we don't take away something that they already have and are happy with.
Working with firemen and women, I feel it's a unique opportunity to kind of tailor to their specific needs as far as how they behave in their daily lives throughout their jobs and their roles. Working at the station, things can go from zero to very rapid response very quickly. I think that's something that's pretty unique as far as how I handle my treatments.
We work very hard to ensure that we are able to put ourselves in the firefighter's shoes and are able to understand their day-to-day operations. We work with very large fire departments, and at the same time we work with smaller fire departments that haven't had the experience of developing a full NFPA program.
So one of the things that I like to make sure people know is that my goal is to make sure they get what they need or they want out of the situation. So being honest up front, what are their interests, what are their goals, and making sure we're very clear on that approach.
There's a term that's called general physical preparedness, GPP. So a lot of times with that, firefighters usually have to be very cardiovascular fit, but also very fit in terms of their strength and their physical fitness as well. So I think, with them, a program that is implementing factors of resistance training and strength training, but also cardiovascular fitness as well. And I think those two aspects would definitely improve a firefighter's ability to perform their job duties successfully.
Part of caring for a fire department full of unique individuals is understanding that everyone comes from a different experience, a different lifestyle, different cultures, ethnicities. The fire department itself, fire culture nationwide, but even a unique department or a unique station has a culture within a culture. All that is taken into account when we develop programming and when we're interacting with the patient to ensure that they feel as though we are respecting who they are. So Reserve Health has set ourselves apart from other folks that provide NFPA physical examinations by tackling an approach that provides 360-degree comprehensive care.
We offer physical therapy, behavioral health, medication management, health coaching, exercise physiology, and case management. We work with our client hand in hand to devote resources towards areas that will allow for better outcomes and overall healthier patients.
We just make sure that we're always available to answer any of the questions that they have. We try to anticipate what they need just based on working with them.
We try to look at all the risk factors that may influence an individual firefighter or a firefighter population within a department and make sure that we're solving for all of those needs beyond just identifying problems when they occur during an examination.
Another very important piece of a program that offers NFPA physicals would be data analytics. It's important to ensure that we are able to show the impact that we're having on every single patient that steps into our door, and the best way to do that is using data and reporting.
Some of my biggest ones that I'm proud of would be quite a few that have lowered A1C, reversed pre-diabetes, definitely some weight loss. Anytime someone can kind of refer back to me and tell me that they've accomplished that is some of the more exciting ones that I see people talk about.
It's hard to explain the joy that comes from someone healing in real time, someone having a breakthrough. But it's something that is unexplainable. It's definitely something that you can't buy anywhere else.
One of the unique challenges of setting up a workplace program for the healthcare needs of a fire department is the unique schedule that they work. So we need to take into account the dynamic family needs or other individual responsibilities a firefighter may have outside of their work schedule and the unique schedule that they work, and ensure that we are developing a schedule that is going to meet the department's needs for their workforce as well as the individual patient's needs.
Reserve Health believes greatly in recruiting the best staff members possible in order to work with these firefighters who might be a little hesitant. We ensure that when we're recruiting for different staff members, we are screening for different skills or attributes that each candidate might possess that will allow them to succeed with the firefighters, especially those who might be a little reluctant or hesitant towards performing the physical?
So I think that we have a very good work culture. I think the staff, they all are very energetic and positive, and they work really well together, and they make it fun for the patients.
From my patients and their experience, I've heard that the environment once they walk into the door is like very friendly, very welcoming.
The most important thing I think is that we let them understand that whatever happens within the clinic stays within the clinic. Their information is not going to get shared with anyone else or any other entities. And that if they have any issues with past exams during the physical, we try to re-educate them on how best to perform that exam so that they have the best chance of getting through it.
I have a huge passion for public safety. These individuals, they sacrifice a lot and they risk their lives every day to help our community.
I feel like a big thing that gives me a reward as far as this job and being in this role is knowing that not only am I serving these individuals that are serving the community, but I'm having a bigger effect on the community as a whole.
We are partners to every firefighter in trying to maintain their health and their safety, for their sake, for the community's sake, for their family's sake.